Minister will make that presentation.
Okay, thank you very much, Stephen, and good evening to my colleagues, the usual colleagues, PS and CMO, and to the team from the University Hospital of the West Indies, and also to Mr. Glasspool Brown, the Director of Elections. Today's COVID conversations, having given you the numbers, will focus on a few things. It will quickly go into an explanation of the numbers, or the discussions behind the numbers, and in particular looking at the spread across parishes and across the country. The CMO will give an overview of that with a few slides. She may, I think, to address some of the other issues of concern, the staff in our institutions, because we know some issues have arisen. We'll ask Dr. Bruce to speak to some of the concerns as it relates to the UWI, which again has been in the news in recent times. And of course, you know, the extraordinary event in a week's time, that's the general elections. And Mr. Glasspool Brown, our Director of Elections, who has been doing the rounds, explaining the protocols around voting on election day. From a public health perspective, we thought it was necessary to have him on to reiterate some of those issues and perhaps answer a few questions from our journalists. So a very interesting set of presentations. We'll keep them short and reserve the more lengthy explanations for the question and answer. So let me get right into the usual agenda item of the numbers. Jamaica has recorded 66 new confirmed COVID-19 cases in the last 24 hours. The total number of confirmed positives now stands at 1,870. Of the new cases, 35 are females and 31 are males, with ages ranging from 7 years to 88 years. They have addresses in Clarendon, 12, Kingston and St. Andrew, 32, St. Catherine, 14, Manchester, 1, St. James, 3, St. Mary, 2, Westmoreland, 1, and St. Anne, 1. One of the new cases is imported from a flight from Nicaragua. The remaining 65 are under investigation. And as you can imagine, having discovered or concluded on the test results, the contact tracing investigation would commence, but this would have been very, very recent. So the bulk of the numbers are under investigation. The classification at this time are 441 imported cases, 515 that are contacts of confirmed cases, 236 cases related to the workplace cluster in St. Catherine, 163 that are local transmission cases not epidemiologically linked, and 515 cases that are under investigation. Of the 1,870 confirmed COVID-19 cases recorded in Jamaica up to now, 45% or 846 have recovered and have been discharged from care. 71 cases or 3.8% have returned to their countries of origin, and 19 cases or 1% have died. There has also been one coincidental death of a COVID-19 positive person, which we can provide some explanation of later on. In terms of healthcare workers, we have not currently. It does say currently here. Is it current or since March? 34 healthcare workers who have tested positive, just cumulatively. So it wouldn't be currently, over the period of time. That's an important distinction. And this, of course, is of concern to us and the ministry, and with the regions, and in the case of the UWI as a sort of standalone. We continue to put the health and wellness of our frontline workers, support staff in the public health system at the forefront, and we continue to appreciate some of the concerns that they have, It's a daily issue. We have to keep in touch, keep the contacts live, and whenever issues arise, then we provide a forum for discussion to resolve those issues. We understand the pressures that they face and, fully appreciate any concerns that are raised. And I think Dr. Bruce will speak more to the issues at the UWI later on. But, our frontline workers are definitely at risk in terms of the COVID response. I want to use the opportunity to also say that we are well advanced with the employment and deployment of 121 medical officers. You would have recalled a discussion around those medical officers who did not have posts in the public health system. We have gotten the go-ahead to engage these persons, and I am told now that we will have contracts effective the 1st of September to engage these 121 medical officers. So in less than a week, those medical officers will be deployed, and that will bolster the numbers in the field and certainly assist as it relates to the COVID response. In addition to that, we have 750 community health aides that are deployed. We're moving to the 1,000 mark, so recruitment is still on. Again, that will be a big addition to the cadre of workers in the field and will help us with the intelligence gathering and information flow, contact tracing, and so on. Beyond that, and I'm announcing this, I don't know if it's the first or second time, I may have said it before, we're moving now to another category of public health workers that we are expanding, and that is our public health inspectors. And we're in the final stages, the Office of the CMO, working with the regions to determining a number of public health inspectors who will be engaged. And the public health inspectors are very important to the process. They are at the local parish level. They go out in the field. They assess what is happening. And one of the primary reasons for engaging them is to provide leadership in terms of, the community health aides to assist with that. Public health nurses do the same thing. But importantly, they will be used to drive the protocols that are in place to ensure that whether it's workplace, community, or otherwise, any protocol that is established around the response to COVID. Remember now we are about living with COVID, and so COVID is around. The numbers are reflecting that very clearly. Those public health inspectors will help to police, if you will, those protocols, supported, of course, by the rest of the team. So they are an important part of the response to COVID, the expansion of that cadre of workers. So in short order, we will make public the numbers and we will start that process. All told, as it relates to healthcare workers, the conclusion here is that we appreciate the pressures of the public health staff currently. The government appreciates the concerns, and we're moving apace to expand the numbers to take some of the pressure off persons who have been in it for a while and, frankly speaking, in some instances are overwhelmed because of the long hours of work. And the categories are public health inspectors, community health aides, and doctors, medical officers, as I spoke to earlier. And this is an ongoing exercise and will continue. There are currently, in terms of active cases, 933, or 49.9% of active cases being monitored, including 7 moderately ill persons and 4 who are critically ill. I want to just pause to say that it's important that we observe carefully these numbers. 933 active cases. So of the 1,870, approximately half of those are just a little over that. Well, half, 49.9%, are active, have the virus. The rest have been released and have gone back into society. Couple of lessons here. One, you can recover from COVID and restore and be reintegrated and find your rightful place in the society begin to work, begin to play, begin to enjoy your family and friends. And that really ought to now speak to breaking down the stigma that is associated with persons who are affected by COVID, who have the virus. Half of the numbers are now back with their families, in their communities, enjoying their lives. And I want Jamaica to appreciate that very important fact. COVID is not a death sentence. It doesn't have to be. And it's not a lifelong plague on any individual or community. Recovery is possible. And we have enough data now to demonstrate that in a tangible way. And we ask the society to respond and receive and welcome persons who have gone through and are now recovered. So that's the first point. The second point I want to raise, which is important to other points to come up, is that if you look at the numbers of positives, you can dissect those numbers to determine who are positive with no symptoms at all. In other words, they don't even have a temperature, they don't have a cough, they don't have any symptoms, but they carry the virus for a period until they're well. And the response along the theme of living with COVID is that these persons are either placed in their homes under strict isolation protocols, again, avoiding everyone else, family members, friends, until they are recovered, as long as they have the home environment that offers that facility. A room with a bathroom where they can be served their meals, maybe using disposable plates and cups so you avoid any possibility of touching. And that is perfectly fine to facilitate recovery. And it's going to be more the norm than the exception. And Jamaicans will have to come to terms with that. The fact that you're positive does not mean you have to go into a hospital. And indeed, the hospitals will be overwhelmed very quickly if we ever took that posture. And that's not the posture that is the standard posture globally. And now that we are living with COVID and more people are getting it, it means more will have to recover at home. To the extent that persons cannot or do not have a home environment, we are making arrangements to place them in an institutional environment, government-secured institutional environment. And we have a number of them around the country, and we're putting additional numbers in place. To the extent, however, that persons are ill, and in this instance, 4 persons are moderately ill, and the doctors can define what moderately ill is. 4 are critically ill. Now look at the numbers. 933 with only, 7 are moderate and 4 are critical. 11 of 933 that really, based on my interpretation here, requires monitoring in a way that says you may need a device in the hospital, not even the ventilator, because that's normally when people are critically ill, and you need special care. The rest, for the most part, can recover at home. I raise the point as a point of emphasis to say to Jamaicans, COVID will be present in our population. It's likely to be more present in the future. And the response to it is to manage it in a way where home recovery will become more standard practice than hospital recovery. And so the hospital capacity is there. We don't want it to become overwhelmed, but it's a matter of how you manage that process. And normally persons who would go in hospital are normally persons with comorbidities, older population, and so on. So sorry for that departure, but I think it's important to raise that point because there's a lot of conversation now around the hospital's capacity to manage. In terms of testing numbers over the last 24 hours, testing numbers for the island are up 55,605. Testing with this 506 new samples over the last 24 hours. In addition to the 1870 positives, there are 53,633 negatives and 102 pending. In terms of community quarantine, an update on that, the communities remain that we had announced last time: Sandy Bay in Clarendon, Lower Summit, Bamboo River, Albion, and Seaforth in St. Thomas. And the intention is to discontinue surveillance in these, before I say that, surveillance in these communities up to August 27th are as follows. In terms of Clarendon, samples collected 483, St. Thomas 849, that's 1,332. Homes visited 1216 in Clarendon, 476 in St. Thomas, that's 1692 in total. Persons interviewed 2813, 2,813 in Clarendon, 440 in St. Thomas, that's 3,253. Persons reached by the health education officers, over 3,436 in Clarendon, and 1,590 in St. Thomas. Prescriptions filled, 241 in Clarendon and 465 in St. Thomas. And team members on the ground, 49 in Clarendon, 79 in St. Thomas. Number of positive cases, 15 positive cases in Clarendon and 175 in St. Thomas over the period of time. So, again, it's very clear that St. Thomas remains a very active area and a point of significant concern. CMO, I believe, will comment more on that when she looks at the spread. The stay-in-home orders and an update on that. There was an announcement around stay-at-home, and it has created some amount of disquiet because persons were not fully understanding or appreciative of that particular order. Let me just announce the latest update of the stay-at-home. There will be no specific stay indoor order for the communities at this time. So to the extent that that announcement was made and persons were concerned as to what it meant, we are now saying as government that we Jamaicans, or those who would have been affected, should abandon, if you will, those concerns, because there are no specific stay indoor orders for the communities at this time. So I don't need to explain what it means or what it would have meant, because we are now abandoning that concept. And we could go into the reasons for that, but I'm not sure it's relevant at this point in time, but later on we can. We have, as the public is aware, implemented a number of other measures, notably longer curfew hours, the prohibition on funeral services and entertainment events, and the curtailment of campaign activities, and those remain in effect. So those are very clear and very specific. I don't think there's any misunderstanding there. Those are in effect. The only issue that is affected is the proposed stay-at-home orders, which have been taken off the table. Having said that, I would certainly encourage Jamaicans, if you don't have to go out, particularly in a crowded place, please don't, because there are risks associated. And if you look at the numbers in the corporate area, the KSA, St. Catherine, these numbers that we have been reporting in recent times are quite a number of positive cases are in this geographic space. And I want to say again, we are at the stage now where we need to assume that everyone you come in contact with is a potential positive COVID person. And that means you must wear your mask, maintain your physical distancing, and sanitize as a first line of defense. No matter who that person is, your best friend, your relative, whoever it is, because COVID is out there. This is what living with COVID means. It's there until we can find a solution, until the science catches up. You don't have to be infected if you take the precaution, but a lot of it depends on you. And I want to make that very clear. So our intention is to, of course, preserve lives as well as livelihoods. And it's important that persons are mindful of the restrictions and the need for activities, economic activities to continue. And that is why, some of the measures have been lifted, restrictions on movement in and out of the country. But of course, those restrictions have created other challenges in terms of the risk profile, and we have to manage that process. We will adjust those restrictions depending on how well we're managing, and that's what we're actually doing. So in conclusion, I want to say to Jamaica, to those who are listening, that as we move week by week through this process, we are in another phase of the COVID pandemic and the COVID response. Indeed, the team at the ministry, the chief medical officer, the permanent secretary, and myself, and the supporting team members that we have, both at the top, at the ministry, and at the center, I should say, and across the country, are fine-tuning and recalibrating the approach that has to be taken in this new paradigm of having greater presence of COVID within the population. And, it is our intention to make a lot more clearer and specific what this new paradigm represents. And, in short order, we are going to unveil, if you will, explain, outline what are some of the additional measures that are going to be important to this paradigm. So I say to the public, we understand the challenges and we're working them through. No one should be in any doubt of that, and we will do what is necessary to advance that process. I'm going to ask the CMO now to quickly repeat the front. Okay, I've spoken so long that people forget, right? No, I know. All right, so today, the 27th of August, 66 new cases, which takes us to 1,870 cases, 35 females, 31 males, ages range from 7 years to 88 years. And the bulk of the cases are in Kingston and St. Andrew, 32, Clarendon, 12, St. Catherine, 14, with 1 or 2 cases in Manchester, St. James, St. Mary, Westmoreland, and St. Anne. So thank you very much. That's the update. Who's next? You? I'm going to ask the Chief Medical Officer now to just give us an appreciation of the spread of cases across the country.
Okay, good afternoon, everyone. Okay, so on the screen we have a map of Jamaica that is colored to depict where we have the concentration of cases, with the darker colors representing the areas where we have the most cases. So as you can see, we have cases right across all our parishes at this time, and these are concentrated in Kingston and St. Andrew, in St. Catherine, in Clarendon, and in St. Thomas. Now we are starting to see other parishes, such as Manchester, St. Anne, having more cases than before. St. Mary, St. James, and Westmoreland, we're having cases as well. And of course, lately, Hanover and Portland, which were areas that we did not see many cases, we are now seeing some cases. Next slide, Stephen. This table would give you an idea of where it is. It's just a table of the information that was there before with the 20 top communities. And you can see that St. Thomas is right at the top in the community where we have the quarantine, where we have 30 active cases. In Clarendon, which is the other community that we have a quarantine in, where we have 27 active cases, but 26 are local cases. And of course, the spread across Kingston and St. Andrew and St. Catherine. Now, I just want to address the issue of St. James, because if you look on this slide, you will see that you will have 16 active cases in Coral Gardens and 16 active cases in Iron Shore. But if you look at the next column, you will see that we only have 3 cases in both communities that are, if you exclude the imported cases and the import-related cases. Now, many persons have questioned whether why it is, if it is that St. James has these number of active cases, why we do not have St. James under any kind of a quarantine. The The reason is that these, of the 32 cases that you see there, 33 cases are imported cases. Now, these persons would have come into country, they would have been placed in quarantine until their results are back, and when their results are back and are positive, then they would have been under isolation conditions. So these persons have been restricted in their movements, and these represent some groups that are isolated together, and so therefore in terms of the danger to the rest of the community and to the parish, it's minimal compared to the other parishes where we have local cases, and these would have been mostly cases that would have presented when they have symptoms and therefore would have been in the communities with symptoms and therefore represent a risk to those communities, hence the reason why we would have put those communities under quarantine. Next slide. To look closer at St. Thomas, we had started out with the Church Corner Bamboo River Summit communities that were placed initially under quarantine, and then we had extended to Seaforth and to Albion. We continue to see an increase in the number of cases in Seaforth and in also some other areas on the eastern side of the parish in Prospect and more to the east. We will see that we are seeing now more darker colors representing an increase in the number of cases. We are happy to report that in the first quarantine area, we are now seeing very minimal. As a matter of fact, I don't think we have any symptomatic cases that have been reported in that community over the last week. And the number of positives in that community over the last week have been very, very few. So we think that we are seeing the results of putting the quarantine on the community under quarantine, in that we are drying up the cases in that area and the spread within that community. However, the parish of St. Thomas remains under some restrictions because we can see that we have right across the parishes other communities that are affected. Next. And here we see a table now with the cases, and we can see that the highest number of cases were discovered in the first community Church Corner that we had the first quarantine placed in. And as I said, many of those cases now would be approaching their 14-day end of quarantine period, and we would not have been seeing any new cases and no new symptomatic persons there. But the rest of the area, Seaforth, that we have recently put under quarantine, you would see that they would be the next highest number, and we are also noticing an increase in number of cases in Prospect. So the other communities, smaller numbers right across the parish. In Clarendon, we had on the 6th of August, we had placed the Sandy Bay area under community quarantine. You will see that this is the darkest colored area where we would have seen the largest number of cases. Coming out of case investigations, we would have seen some cases in neighboring communities, but then we would also have been picking up through our other surveillance measures, including respiratory surveillance conducted in hospital, other cases in the parish that we would have traced to these communities, and we would have done community investigation, community surveillance in these areas, and we would have picked up additional cases. So in the area of Frankfield, you will notice that we did have a small cluster of cases there, and also in the Four Paths area, and then now we're also seeing problem arising in the race course area. So persons in these areas that we are indicating that we have increased number of cases are to be extra precautious, take extra precautions rather in their activities to make sure that they adhere to the infection prevention and control measures, and that they are staying at home as much as they can, and to avoid contact with persons who they may spread to, just in case they have been exposed to the virus. So these are the active areas. Sandy Bay, as we said, And over the last couple of days, we have not been seeing an increase numbers in this area. Again, we are seeing the effects of the community quarantine. We have not been seeing any symptomatic cases, and we have not been having any new positive cases in the Sandy Bay area. However, we are seeing cases in the racecourse area, so persons within that area need to take all the precautions that they can to protect themselves and their families, and also in the area of Frankfield, and we mentioned Four Paths, Palmer's Cross, those areas persons need to ensure right throughout the parish, but in particular in those areas that they are taking the precautions to prevent infection. Kingston and St. Andrew represents an area of great concern, and we have said this several times in these meetings that we are picking up quite a number of cases right across the Kingston and St. Andrew. In particular, you will notice that in the Constant Spring area, in the Greater Duhaney area, in the Halfway Tree area, and in the 3 Miles area, we are having our greatest concentration of cases. But you will notice that there are other areas that are getting brighter on the map as day to day we are picking up a number of cases, and we are seeing these cases right across the communities. It again means that in these communities and right across Kingston and St. Andrews, persons must take the necessary precautions to prevent any kind of exposure of themselves, exposure of their families, and of course, most importantly, when you put yourself in the way where you can become infected, you risk exposure to your family members who may be vulnerable and are at the risk of developing severe infection. So persons right across Kingston and St. Andrew must take the necessary precautions and adhere to the rules, the policies that are in place in workplace and all over to ensure that they decrease their risk of infection. These are the areas that we have noticed that there is an increase in the number of cases, and we're talking about Barbican in the Constant Spring area, Duhaney Park area. Notice that we're seeing lately an increase in the number of cases in the Mona area as well, and of course Patrick Gardens and those areas in the Greater Duhaney Park, Greater Duhaney developmental area. So this is what the cases, this is where the spread of cases lie. And so again, we can't ask enough for persons to take the necessary precautions.
Okay. Oh.
We can stop now.
All right, thank you very much, CMO. We thought that this exercise of just going through the numbers by communities, parishes, and by extension, of course, collectively through the country, it was very important, because this phase of living with COVID, it is going to be very important that Jamaicans arm themselves with information. Information is by far the best tool you can use to protect yourself. So if you live in these communities, it doesn't mean anything more than these communities have positive cases. It's not an attempt at stigmatizing the community, not an attempt of telling persons that you somehow live in a community that is undesirable, but it is a recognition that the risk profile within these communities are slightly greater than in a community where the virus is absent, at least based on the information we have. Because the underlying assumption should be that COVID could be anywhere. And remember, we only report the information we have. Until we get that information, the reality is that COVID could be right next door. It could be in your homes. So you have to still be cautious. But to the extent that we have it, our commitment in public health transparency is to let the information out there, to give all concerned the information. And like I say, we now have 1,800 plus. Half have been sent back to their homes and are in good order, healthy. Half are being treated. There are going to be many more who will have the virus, many more who will recover. And we want you to know that this is the new norm that we have to grapple with and confront and get accustomed to. And these communities that are affected are an approach to giving you the information. We're not hiding anything from anyone because we think that you are in greater danger to the extent that we allow you to feel complacent or too relaxed. But we're not asking anyone to panic and to run scared and to go lock up and never go outside if you have to go to work. That's not what we're saying either. So I want to thank the CMO for that, and we will continue to make that kind of information available. In fact, Stephen will mount these charts on the website, so you can feel free to visit when you have time to review, and again, to inform yourselves as to what needs to happen. All right, so Dr. Bruce, first of all, I'm sorry I didn't mention the Senior Legal Medical Officer of the University Hospital, Dr. Peter Glegg. Thank you for being here, sir. So we have the CEO, we have the lawyer, doctor, and we have the senior medical man, right? So we have a heavy team right here. So Dr. Bruce, today we have had a lot of discussions around doctors who are concerned based on a letter that has gone, I don't want to say viral, but it has gone public and has been making the rounds, that's been on the news. And of course it involves the university. Just come around a little bit for me, yeah. And, I thought it was important for you to comment on it, as well as the concerns that have been raised about the university being at capacity in terms of beds, COVID that is. And you and I have had a discussion, but I think it would be more credible coming from you. So if you just use 5 minutes to just quickly run through the concerns and how you are addressing those concerns.
So thank you very much, Minister, and good evening, everyone. I think the last time we spoke to the media would have been 3 weeks ago in an interview that you would have seen replayed on Monday, the 24th of August on TVJ. And at that time when we spoke, we had 2 active cases at the university, and we had outlined what our surge plan was at that time. Since then, and as of today, we have 23 active cases at the university. 4 of those patients are critical, and one patient is intubated. But we also, as you know, test the patients who we admit as emergencies at the university, and that testing will yield, even though the doctors will go ahead and treat our emergency cases, the test will sometime return positive. And so from time to time, you will have cases that are not on the COVID ward that's picked up by our screening tool. And so this evening we have 3 patients on the surgical wards that we are waiting to be transferred to the COVID area. We also have 2 patients in the emergency room who have tested positive and who will be admitted. As was outlined before, we are admitting to hospital only those cases which are serious, obviously moderate or severe cases, but cases that our specialists deem need to be in hospital, whether it be for supplemental oxygen and management, physiotherapy, etc. The other thing that Minister mentioned earlier was the letter from our doctors. And, whenever the clinicians at the university speak, we really listen to them. We're very empathetic to them, and we take them seriously. And, I must say that we are humbled by their courage. We have been inspired by their compassion, and we are grateful for the service that they have given not only to the university, but to the Jamaican public. In the initial part of the pandemic, about 8 of our healthcare workers would have tested positive. Since the surge has occurred, or the increased number of cases, we have had about 9 of our doctors test positive. We expect this number, unfortunately, to increase. As we said, we don't deny care to our patients, and therefore, when we admit the emergencies, even though we are going to take care to ensure that all possible precautions are taken, and that we test them as best as we possibly can. That delay between testing, getting back the result, and the doctors treating or doing emergency surgery is going to result in a period of exposure that we cannot control. And so as the number of cases increase, we would expect that more of our healthcare workers are going to be affected. We have met with the residents, and we have met with the heads of department, the CEO, the head of HR, the legal officer, and the residents themselves, and the head of department, Professor Boyne. And as the number of cases increase, we know that we have to reinforce these teams, and we have that plan that's there to reinforce the team. And we, in some instances, will have to ask the other specialties to help with their patients as we go forward. So, for example, if surgery has patients who they are actively managing, the surgeons will participate in the management of those patients. We have pregnant patients who are also being managed by the Department of Obstetrics and Gynecology. They still have to do those cesarean sections, and obviously the pediatricians will have to do the delivery. So all departments are involved, including our laboratory, our diagnostic and investigative services, and so all of them will be at risk. In addition, as you know, one of the treatment strategies is proning, and it requires a lot of physiotherapy to turn the patient's face down. And so our physiotherapists will also be exposed, in addition to our nurses and our laboratory staff. So having said that, we have come up with some solutions. We have been advertising from December. We advertised in December of 2019 for additional medical officers to reinforce those doctors who are studying. At that point, we had no take-up. We advertised again in April, and I believe we had 2 doctors. In June, we advertised, and we have gotten so far 3 responses, and 1 person will start September, the other one 1st of September, mid-September, and the other one in October. So we are trying to reinforce the staff, but what we've also done is to try and decrease the number of what we call elective cases, planned surgery, so that we can focus on those ill patients. One of the phenomena that we were seeing and that we expected and that we communicated was that the people who, in the lockdown, who have chronic non-communicable diseases that the ministry speaks about so often and who did not seek care in the lockdown, or those who got ill and had urgent cases in the lockdown but decided to stay at home, are now coming into the emergency room. So we now have a large population of non-COVID cases who we are managing the non-COVID area of the hospital, and that adds some strain to the system, but we have to take care of these patients, and we also have a plan for those patients going forward. I would like to say before I close that the situation as it is now will require us to expand. It may require expansion of our intensive care unit capacity, and it may require expansion of our ward capacity. At the present time, even though the ward is at capacity, what we plan to do is to move elective or non-COVID patients out to expand our COVID wards. So the COVID ward can hold a maximum of 17 patients at present, but we had already retrofitted another ward area at the university to manage COVID patients. And so we'll activate those areas, and we'll also activate our ward in the Tropical Metabolism Research Unit. That ward, as you know, was closed because of the success we had with the management of patients with marasmus and kwashiorkor, so-called malnutrition. And in winning that battle, we now have some space there, and we'll retrofit those spaces to take some of the non-COVID patients. So I think those are the strategies that we are using and we'll continue to use. But as we test, we expect that there are going to be more healthcare staff that we really have to take care of, and more patients who will present to the hospital. And so we'll make a plan for them as we go forward.
Thank you, Dr. Bruce. So just to, and I'm sorry, I have to remove my mask when I'm speaking, and I'll put it back on right after. Just to be clear, for the purposes of the public, we, and I'm speaking on behalf of the UWI as I am on the public health system, we don't deny care, and persons can expect to be given appropriate care based on their needs. And I'm sure UWI has done that and is committed to that. The issue now becomes, however, the more we have to deal with the challenges of COVID, along with the other issues that have to be dealt with in the society, other ailments, particularly this time of year, is the greater stress that is placed on the infrastructure. And what we have seen in the past couple of days has been some stresses on the infrastructure. And in particular, we've had the Cornwall regional experience where we've had some positive cases, which has triggered the quarantining of other persons, because you have to now ensure that all persons, not just those directly affected, but those who could have been affected, are secure. And it has placed a strain on the institution. And so we have had to reschedule, suspend some services and so on until we are back up. Tomorrow, I understand, is it tomorrow? The team from the ministry, a team from the ministry led by the permanent secretary will visit Cornwall Regional, KPH, and they will sit with the team there and have a conversation to see how we can further address some of the concerns. And that is going to be a standard procedure. Wherever there are issues, we will respond. We can't predict all of the issues. If there are concerns that emerge, we move in. We want to be responsive to what the problems are. But we can't avoid all the problems, because the nature of what we do requires risk-taking and calculated risk-taking, but is going to require us overcoming challenges. So the team will go, and I intend to also visit in short order. The CMO is going to comment on that, but let me finish the point on Dr. Bruce's presentation, that what we're doing is responding to the concerns of the capacity issues. And as Dr. Bruce has said, just to be very clear, they are making adjustments to expand the numbers. Now, you and I had a conversation on some specific numbers. You may not want to give those numbers, but based on those adjustments, I'm anticipating in a day or two, you should be in a position where the bed numbers should be expanded. Is that a fair assessment?
That's
you can
correct.
say it if you want. I mean, I don't wanted you to say it, but because I want people to be very clear that we are going to work to ensure that the university is available to deal with the more severe cases based on the specializations that you have, which allows you, as is the case with KPH, to deal with those cases. I think that's important.
Yes, I think, as I said, Minister, we want to expand for both non-COVID and for COVID cases. So we have a ward that we are opening tonight for non-COVID patients to move them out to the emergency room.
Right.
And we will also move some patients off the regular wards a ward that we retrofitted from COVID can now be activated, and that would provide up to another 23 beds.
Okay.
So that's our plan, and we are executing our surge plan, and we'll continue in a stepwise manner to do that, depending on how many cases we admit.
Thank you, Dr. Bruce. CMO wanted to come in here.
Yes, thank you, Minister. I really just want to take a few minutes to just address our healthcare workers who are at this time feeling particularly vulnerable, and rightly so, because at this phase that we are in managing the pandemic in Jamaica, we are seeing an increased number of cases. By virtue of the increased number of cases, we are going to be seeing an increased number of persons needing hospitalizations, persons that are moderately and severely ill. And we're also going to be seeing persons that are coming in from our communities who they're not there for any kind of COVID reason, but they turn out to be COVID positive because there is spread of COVID within some of these communities. So the healthcare worker is particularly vulnerable to becoming exposed. And the Ministry of Health is making every effort to ensure that we have adequate number of personal protective equipment. We understand that you need to have these personal protective equipment. We are operating in the face of global shortages, and our procurement teams are on the job every single day trying to ensure that every week we get in supplies. So we know that from time to time there will be challenges. However, we are asking that persons ensure that the they use the personal protective equipment that is available consistently, and that they consider that every possible patient could be COVID infected. We also have to consider the possibility that our colleagues may also be infected, and so therefore we must also be consistent in the use of the personal protective equipment when we relate to one another. We are asking at this time that healthcare workers make a more than special effort. The regular person on the road have to take all the necessary precautions in their daily activities. Healthcare workers even more so, because the country is dependent on healthcare workers to be there. You know, the assumption that healthcare workers cannot get sick. I mean, I have had situations where I've spoken to patients when I may be ill with something, and they say, boy, doc, we never know that doctor can get sick too. Because they figure that if we get sick, then by some magic, we will get better very quick because we know how to treat it. However, COVID has no respect for persons, and healthcare workers are just as vulnerable as the rest of the members of the communities. But we are so dependent on our healthcare workers to be well and to be able to serve the rest of the population. And so we have to ask that our healthcare workers take especially precautions to keep themselves safe. To keep themselves safe because we know that we have a responsibility to care for the population. So it's a difficult time because we face the challenges within our own communities, within our own families, that we have to address how it is that we prevent exposure, and yet we work in a situation that we also are exposed. But the proper use of personal protective equipment can reduce that risk from being in a high-risk environment to low or no risk if we have the consistent use of personal protective equipment. Again, I just want to reinforce that we are making every effort to ensure that we have those personal protective equipment in place. We want to make sure that everybody is consistent in their use.
Thank you very much, CMO. And we will get back to this based on questions asked. I want to just move quickly. Do you have the Director of Elections online, Mr. Glasspool Brown? Just by way of context, ladies and gentlemen, as you know, next Thursday, the 3rd of September, will be our democracy on stage and at play, where Jamaicans are given the opportunity, the right, under the Constitution, to go out and to express themselves through the ballot box. Very, very important part of our democracy. And COVID has, without a doubt, placed some additional challenges this time around. And so we have had to take the necessary precaution to protect public health while guaranteeing that right. And it's a tall order, but one that we are certainly up to, both at the Ministry of Health, but also working with the critical agencies, and the key one being our electoral commission, the electoral office. So we're going to ask the director, we wanted the Director of Elections to come on for to give us a 5-minute overview as to its level of preparedness, and also the key pointers as it relates to the COVID challenges and how they intend to conduct themselves. And we will give whatever support, of course, from public health after that, and then just stay on for any questions that may be asked. Mr. Director, are you on?
Thank you, Minister.
Thank you very much for coming on, sir. I know you're very busy, especially with a few days to go, as I am busy. but we're happy to have you. And, we have to work together. And, we've been working together. So I wanted to give you an opportunity using this platform to just tell Jamaica, tell those who are listening, how prepared you are from the standpoint of the COVID. It's really the public health standpoint that we're we're sort of giving you an opportunity to speak to.
All right, again, thank you again. Just to say that we are well advanced in terms of our preparation. We have been going, some aspect of the operation has been running for 24 hours. We must be aware of the mandate of the Electoral Commission of Jamaica, and certainly the mandate of EOJ is to ensure that we have a free and fair election, allowing everybody who's entitled to be a part of the process, be able to do. We are operating in a COVID pandemic environment, and what the commission has sought to do, and we put out a lot of information there. Actually, yesterday we issued a press release. What we sought to do is to put together a protocol, which was reviewed by the Ministry of Health and Wellness, and also look at what prevails in terms of WHO standard and PAHO standard. I went a little bit further to look at what took place in other jurisdictions in terms of how they operated in their election. Recently, Trinidad had their election. We looked at what happened in South Korea. We looked at what happened in Suriname and in St. Kitts. And we looked at as far as India in terms of what they were doing. And so we have come up with a protocol which we intend to roll out on election day. We did so on nomination day, and certainly we think we did fairly well as it relates to venting that issue. Most of the problem was outside our jurisdiction, outside our area. But what took place in the nomination center clearly give an indication what will happen on election day. We're gonna basically break it down into two aspects. One is focusing on our staff that will be using in election in terms of, the second aspect would be in terms of the elector. Our approach and the posture that we take on election day, that we are assuming that everybody that enters that polling station location is COVID positive. And therefore, starting from that base, we have decided to put in place a number of protocols to deal with the issue. We have sought to recruit in excess of 7,400 persons, and we have put them into our team known as the sanitization team. Those 7,400 persons will be spread across the 2,200 polling station location on election day. That team is geared towards ensuring that every person who enters our polling station location has on a mask. And also, that team will ensure that everybody who enters through that gate is sanitized and their temperature is taken, and then they are ushered into the polling station. For our workers, the workers that will be using in excess of 20,000 persons, every worker will have on a mask, they'll also have on a face shield, and also they'll be given the necessary sanitizing liquid to keep that process going to the day. So what will happen when the elector enters the gate? And again, I just urge everybody who is listening, ensure that when you come to the polling station that you have on a mask. There are persons who might ask why the EOJ or ECJ does not provide masks. On the list itself has 1.9 million persons. It's impossible for us to provide that. So therefore, we urge everybody to come to the polling station, wearing a mask. When you enter that gate, you'll be ushered into the polling station. What will happen is that on approaching the presiding officer, you'll be asked to temporarily remove your mask just for a couple of seconds, but the presiding officer can do the necessary identification check. Then you'll be asked by the presiding officer to replace your mask again, to put back on your mask. The presiding officer will then give you certain instruction. That instruction will include how to mark the ballot, and they will direct you behind the voting booth. What has happened in the past that you normally have a pencil tied to the voting booth. In this case, every elector will be given a separate pencil to go behind the voting booth to mark the ballot. And what will happen after that process is completed, they will then return to the presiding officer, taking along with them the pencil. That pencil will then be placed in a special box. And what will happen, after a certain number of votes, the pencil will then be removed by a member of our sanitization team and then re-sanitized. So no elector will be using the same pencil more than once. Every time you use a pencil, it's a sanitized pencil. And then the presiding officer will then go through the process. before the elector is asked to dip their finger in the ink, the presiding officer will then again instruct them to re-sanitize their hand, and then before inserting that finger into the ink. Suffice to say though, that ink that we'll be using is alcohol-based, and it has certain chemical features that prevent this transmission of infection. So, prior to the dipping of the finger, every elector is required to re-sanitize their hand and then proceed to dip their hand in the ink. And then they'll be instructed to out of the polling station and hope that everybody will then proceed to go home. So we have put in a number of checks and balance. Frequent sanitization will take place during the course of the day. The 7,400 persons that we have brought on board to assist us will continue that process on a regular basis right through the entire voting process. And the process starts at 7 a.m. and completes at 5 p.m.
Thank you very much, Mr. Director. I appreciate the step-by-step explanation of what is likely to what will transpire, and we certainly encourage Jamaicans to cooperate with the electoral office and work on the ground, because it means giving instructions and having enough information out there so people will follow those instructions. So I think this is a good opportunity just to further do that. Now, from public health perspective, our position is very clear. We want persons to exercise their rights in a way that is safe for them and for others. And I'm speaking here now, obviously, as the Minister of Health, not as anything else, that the public health team will give the support, will make themselves available. And I want to announce here that the Ministry of Health has taken a decision in consultations with the team that I have here, through the NHF, that we will make some masks available masks and sanitizer available to all candidates that have been duly nominated across Jamaica, whatever political persuasion. All duly nominated candidates that you're printing ballots for, will get a quantity of masks and some sanitizer through the electoral office, through the National Health Fund, as part of our public health mitigation measures. And this is the first time we're announcing this, but the details of it will be worked out. And we may need, this is the NHF now, Mr. Commissioner, may need to touch base with you just to validate and verify that these are in fact all the candidates, and they will be entitled to a small quantity in the interest of public health. So I just want to make that as an announcement. All right, I think we're spent a lot of time in the monologue. Maybe we should move now into the questions. So Stephen, over to you. Mr. Commissioner, I'm going to ask you to just hang on a little, just in case there are any questions for you, sir. Thank you.
Okay, Minister.
Thank you very much. Just reminding our media colleagues to use the raised hand feature on the Zoom. And we're going to begin with Janet Silvera.
Thank you. Good evening. My question is to the permanent secretary, if he's there. If not, maybe the minister can respond. A number of hoteliers have said that their guests are still faced with the fact that they can't get authorization to come to Jamaica. If they do get authorization, they get it on the morning of, when they're already in the airport. So sometimes they go to the airport, they don't get on the flights. In addition to that, the UK today said that they've taken Jamaica off their list of travel corridors. I'd like to find out from you, what if you're very concerned about this, the fact that persons coming from the UK or persons going to the UK from Jamaica will now have to quarantine for 14 days. And you also said that the restrictions that we had before as Jamaicans traveling, you're moving those restrictions. I'd like you to elaborate on that. travel restrictions that meaning?
Thank you, Janet. I'm going to ask the Permanent Secretary to deal with question number 1, and I'll take the second. I'm not sure about the third question. I might need some clarity on that because I'm not aware of that. But PS, you want to go with the first question?
Thank you very much, Minister. Thank you for the question. So we understand and appreciate that over time, we have had persons who are traveling to Jamaica, especially tourists, who need to provide the COVID negative test as part of the travel protocol, may have had issues. Now, the Ministry of Health has recognized this, and we have put in place additional resources to eliminate the backlog. So, we had approximately 1,386 applications for travel today. We have no pending applications within the system. We have 1,496 applications for tomorrow, and we have cleared all applications. And then for the 29th, August 29, we have 1,085 so far, and we have cleared 50% of those persons who are to travel. What we do recognize, however, as we go through the process in the system, is that many persons are uploading tests that cannot be validated. And therefore, we have had to decline or reject the application, and that poses challenge for the persons to get the boarding clearance that they need to travel. And so we continue to indicate to travelers that it's a PCR test that has to be uploaded and not the antibody test. And that's one of the major problems that we are seeing, where persons are uploading antibody tests to the system as their validation for travel. And the requirement at this time is for a PCR test to be uploaded. And so many persons complain that their approvals are not granted, not because they are not clear, that they are not reviewed, but because the submission that they have made is the incorrect submission. And so that's the update on that.
All right, so basically, Janet, it seems that we are moving to clear up the backlog, and based on what this PS has said, the next couple of days have already been processed, and by day 3, half of those. So we will try to always keep ahead of the processing, at least by a few days. On the issue of the second question that you asked about the UK lifting its travel restrictions or imposing travel restrictions, the requirement of 14-day quarantining, we have to respect the right of all countries to do what they think is in the best interest of their population. And so, one has to accept, if in their judgment that is their most reasoned position, or position that they have justified. We clearly also have to make our own decisions, and we have made decisions that have sought to balance the lives with livelihoods, which is why the Living with COVID theme has become a dominant part of our approach, our theme. You live in the tourism mecca of the West, and the accommodation that we have made for tourists. You're very aware of that. You follow that, and with that kind of lifting of restriction, whether for tourists, nationals or non-national, comes risks, and the numbers we're seeing today are a direct reflection of the increased risks associated with balancing lives and livelihood by allowing more people to come and go. And the risks associated with that is that other jurisdictions may look on and feel less confident that positive cases coming out of Jamaica are likely to reach their shores. It's a catch-22. You're either going to shut down and then have none and then minimize that risk, or you're going to gradually open up and increase the possibility of that risk. And I suspect that's what the UK maybe examining. We have our own concerns about persons coming out of the UK, and we have put some measures in place. I think over time things will become aligned as we work together as a world to find solutions to COVID, better solutions as technology catches up. But for now, the sort of motivation to manage based on what is in one's best interest at the national level is something that we can't frown on, because frankly speaking, our perspective is not much different. I don't understand the third question. You were asking about lifting of restrictions. If you're asking about the orders, the stay-at-home order, I'd said there was an initial announcement around that. We're withdrawing that, but still advising persons to manage their movement carefully based on the risks associated with COVID.
Okay, I was speaking to the fact that Jamaicans were being encouraged not to travel outside of the country. So I thought you were speaking of the fact that they have to be tested before they are able to return home.
No, I don't.
That is what happened to a Jamaican who went to Fort Lauderdale 2 weeks ago and could not return home because that person was told that they had to go back to the jamcovid.com in order to return home.
No. To return home, you have to go through the JamCovid site, but not to do a test before you come. Nationals are not required on that to do a test. They come, they have to be quarantined, whether they go up for a day or an hour, but they have to come back via the site. It doesn't matter how long they stay, they still have to apply on the site to come back in, because we need that information. And we need also for them to remind themselves about some of the obligations that they have once they get back here. All right, next question.
All right, thank you very much, Minister. We're going to go to Dion Jackson Miller.
Okay. Evening, everybody. I have 4 questions. I'm going to ask the first one, and then for Dr. Bruce, and ask the other 2 together, and the 4th one is for Dr. Tufton. All right, so Dr. Bruce, I listened to you with interest. You said, quote, whenever the clinicians speak, we really listen and we take them seriously. Now, I have a copy of not just the letter that was sent to the JMDA, but a letter that I understand was sent to the head of internal medicine and copied to you. The doctor said, and based on what you said, I need to quote a little bit from it. They said, we're concerned for our safety, for our mental and physical well-being. To say we're exhausted and fed up with how we've been treated is a gross understatement. It's unfair and unethical for our internal medicine colleagues to be the lone soldiers in the fight against the pandemic. They go on to say, our concerns have been raised on many different occasions with the heads of the department and UHWI. These discussions have proven futile, as a resolution is usually instructions to see the patients and dispose of them instead of conducting a root cause analysis. They go on to say, we feel unsafe and powerless as our voices and concerns continue to fall on deaf ears. We are stretched thread thin. We are on the brink of collapse. And we call on your assistance to promptly pull residents from all and MOs and SHOs from all departments to continue the fight. Now, what I'm hearing when I listen to you, I have to tell you, Dr. Bruce, it sounds like a rush to address longstanding problems after the doctors got to the end of the tether, went public and threatened to walk off the job. Can you respond specifically to their assessment of you and your hospital management as insensitive, unresponsive, and uncaring? That's my first question. I'll go to the others after.
Yeah, thank you very much, Dion. In the 70-year history of the university, all our doctors and all our departments have always worked together during times of crisis. At the present time, based off what we have in terms of COVID-19, the infectious diseases specialist would lead, along with infection prevention and control, and occupational health, which is our specialist who takes care of the staff. The other departments are, however, involved. They also have positive COVID cases. And because departments such as surgery actually have to manage and operate on patients before they know their COVID status, they also have a significant risk profile. So, for example, at the present time and in the previous period before this increase in cases, the persons doing emergency surgery are segregated into two teams. If a member of that team is exposed or get infected, then that complete team goes off. So what it means is that some services are only functioning at 50%, and as a result of that, they are not in a position to then go off to another department. So all the departments who are treating COVID patients will need to be segregated, and therefore already you have a 50% decrease in their regular staff allocation. Let's just talk a little bit about internal medicine. When we addressed the media 3 weeks ago, we had 2 cases and 1 COVID team. As the numbers increase, what the head of internal medicine will then do is increase the team appropriately, because they still have the non-COVID patients, which are the majority of patients. And as I said before, many of those patients did not come in for treatment during the initial lockdown period. As a result of that, they are seeing some of their complications being uncontrolled. And so there are a significant number of them who still need to get treated. What we did in response to that is, starting back in December of 2019, we decided that we needed to increase the number of people in internal medicine. So beyond the program residents who are studying, we did a consistent program of advertising for what we call medical officers. We didn't get any in December, we got 2 in April, and we got 3 in June. What we also did is that we assigned several specialty senior house officers that they wouldn't have had before. And so we, starting in December of last year, increased their capacity by 30%. But as a result of the increase in number of cases, we just have to go back again, advertise, and see whether or not we can increase their numbers, while internally we decrease the number of elective cases to try and free up those doctors and those beds for those cases.
I'm not sure you answered me, I'm asking doctor about the concern that your doctors have, that you are not listening to them, which is why I read specifically from the letter where they say we have met on many occasions and our concerns have fallen on deaf ears.
Yes, I think to be quite fair, I'm not sure that we have met with the doctors complaining on many occasions. That's not the case. At the times that they have asked, we have met, but what we have said, we have been proactive because we brought in a specialist in 2018, 2019 to look at the situation for all medical staff. And the occupational health specialists pointed out those staff right across the university, all departments, who were at risk for burnout. And so long before COVID, we started addressing those issues. So I think to say that we are just, for the first time, looking at burnout is totally inaccurate. And we are probably one of the only hospitals in the Caribbean who have a team of occupational health to take care of our doctors. The second thing that we also did is we established a team to support our staff during COVID. And that was done even before we got our first case. So you would know, for example, we have a team led by Professor Gibson and the psychiatrist and psychological support team, specifically for staff, not just for patients. There's a separate team for patients. And they also create a list of strategies for our staff, including a video and including sessions for our staff. And we have also created sessions where all the staff can go, not just individually, so that they don't feel that they are being singled out. So we provide group sessions as well as individual sessions, psychological support, as well as hiring to try and ease the burden as we go forward.
I'm going to ask if If I may, the
All right,
CMO to just come in quickly, Dion. She wants to just come in briefly on this. Go ahead, CMO.
Yes, Dion, I want to recognize, with the rest of Jamaica that we are entering into a new phase, or we have entered into a new phase. And this is a phase that is going to affect our hospitals more than it has over the last couple of months, the impact of COVID-19 on our hospitals. Our measures so far while we have moved to strengthen our hospitals in terms of increasing capacity, our measures so far have focused on what's happening out in the field, in the communities, at our points of entry. I think as a ministry, the minister, the permanent secretary, and myself as the executive management and the rest of the team at the ministry are now looking at this new phase in terms of even more preparation, in terms of particularly focusing on our healthcare providers and how it is that we address some of these issues, not just at the university hospital, but at all our hospitals, because pretty much eventually, if we continue along this path, all our hospitals may be affected. And so we have to start looking at creative ways into how we can get our healthcare workers' needs attended to, how it is that we can provide rest and recuperation periods, even if it is short periods, how it is that we can work with the HR departments to provide some amount of more support for these healthcare workers. This is new for all of us, and many persons might have asked, didn't you see this coming, and didn't you think that this was going to happen? The fact is that we operate in a situation that even before COVID, we're limited in our healthcare workers. We don't have a situation where we can have one set of workers working and another set resting, and then we turn them around. Unfortunately, we're not at that place, and so therefore we have to work within the constraints. But I believe that in taking this on from a ministry perspective, we can come up with some measures that will try to alleviate the stress that the healthcare workers are under.
Dion, in the interest of giving some other persons a chance, can I get one of the three other questions that you have? The most important one that you want to ask, or two? And then we'll try to be brief with the responses.
Well, two of them are really very closely related, because the doctors have asked for, they've spoken of healthcare workers in full PPE collapsing after attending to COVID patients for hours on end. They've spoken of 16 plus hour shifts. They've asked for a 5-to-1 patient to doctor ratio to reduce their exposure. So I really wanted to know, is that something that's going to happen? And also, how many vacancies do you actually now have?
So, as was said earlier by the CMO, and I said it earlier from a policy level, that we are in the process right now of expanding the category of healthcare workers. I've seen the letter myself from the Ministry of Finance, which will now allow us to deploy 120 more medical officers effective September 1. So those are going to add to the cadre at the level of the doctors. Then, of course, we're working now on the public health inspectors. We've deployed 750 community health aides.
I know, but at UWI.
At
UWI, the doctors are.
Right. So the point I'm making is, UWI will also be a part of that conversation. In fact, I was just speaking to Kevin Allen, the CEO, just prior to coming in, and the extent to which they will benefit from some of that deployment, we'll work with them on it. But very importantly, UWI, this letter that has surfaced in the public space does make UWI the current topical point of discussion. But the absolute reality is, all hospitals, particularly those in our urban, the more populated urban centers, whether it's Cornwall, KPH, and a number of others, have similar stress related to COVID and all the other responsibilities they have. So I think that a new deployment will help, but the CMO is very correct. We never had more than enough or excess capacity in the first place. So can you imagine this extra stress and what the COVID is causing? So we're going to work, and the new plan is going to try to address that. All right.
Okay, we'll follow up with Dr. Bruce tomorrow then. Dr. Bruce?
Thank
Okay. No, I was saying that I can, if you have something that you need clarify, I can clarify it for you now.
I mean, that's okay. We'll follow up with you tomorrow. My
follow up
producer will
tomorrow
call.
because
The
we have some others. Thank you, Dion. I
Yeah,
appreciate it. Okay. Go ahead, Stephen.
Thank you very much. We're going to go to Emma Lewis.
Hi, yes, good evening. The CMO had said that Kingston St Andrew is an area of great concern at the moment, and I'm wondering why you're not considering putting any of these areas that you mentioned under quarantine, or have you not reached that point yet, or is there a reason why you're reluctant to do so? I also wanted a little quick update. I think Princess Margaret Hospital is under some pressure, or it's run out of COVID beds as well. I wondered if you could give us an update on that. Thank you.
Right. Good evening, Emma. What was the first question? Right. In terms of the Kingston and St. Andrew, as you can imagine, it's a very difficult area to manage. It would be a very difficult area to manage in terms of quarantine, simply because, I mean, we have over 1 million persons that live in Kingston and St. Andrew, the walls of every community are so porous that in terms of managing movement and restricting movements in those communities would be extremely difficult. Therefore, we would press more for general restrictions, which some have been announced already, in terms of getting those areas under control. Hence, this was one of the main reasons for the curfew, increasing the curfew hours, to get persons off the streets into their homes and to decrease the amount of movement in the communities. We have also imposed some further restrictions on gatherings. And we will be looking at these communities. We will be looking at what is happening and monitoring to see what happens in this 2-week period that we have imposed these restrictions, to see if there is any kind of change. Because persons have to understand that if it is that the personal responsibility is not taking control and persons are not staying at home and abiding by the general measures that are in place to control exposure, then that is when we move to general restrictions that nobody likes. And so for these areas, these very, very populated areas as we have in Kingston and St. Andrew, we really do have to look at more general measures to be applied to these areas for control. In terms of Princess Margaret, we are looking at how it is that we can alleviate the bed space issues at Princess Margaret. We have discharged some of our persons that are from in-state quarantine, and we are looking to see for any new admissions, persons that do not need admission to hospital. There is now space available in some of the state quarantine facilities that we can move persons to. So we will be paying close attention to the assessment of persons, whether they need to be in hospital or not. I know that some persons would have been discharged from Princess Margaret. Some persons would have been coming to the end of a quarantine period or an isolation period. And so therefore, we can expect that some of the beds will become free. So we expect that there will be some improvement in that situation, and we'll be monitoring it closely. However, we do understand that at this time, St. Thomas is under some stress, and so we are paying close attention to this matter.
Just to say, that's why spent some time earlier speaking about breaking out the number of positive cases where asymptomatic versus symptomatic, persons with underlying conditions versus those that don't, persons over a certain age. Hospitalization is going to have to be qualified where it is most needed because you will never have enough beds. And in the case of St. Thomas and Princess Margaret, they have, is it eight COVID beds? Nine beds. I spoke to the medical team there myself this morning. They were releasing one person today. They've had one who was symptomatic, and I was told that the others had varying degrees of very mild symptoms. And they also have capacity to house persons in a non-hospital setting that meets the isolation criteria. My view, I mean, it's very clear, and this has been an ongoing thing. The CMO has spoken to it, so I'm just repeating it because I think it's important. Where those persons are not requiring hospital care, they should be in an alternative facility and recuperate from there or get better from there with the medical team in the field checking up on them. And I think Princess Margaret has done further qualification, if you will, of those persons. And as a consequence, will free up some beds for persons who would need those beds.
Thanks much, Minister. I think we just have two more participants. We're going to go to Kimon Francis.
Evening. The question is for the Director of Elections. I've heard the steps to be taken on election day in terms of operating with the coronavirus. But what I've not heard is what will happen if an elector registers a high temperature. Is it that that person will be turned back? What is the measure that will be taken to have that person vote?
Is Commissioner on? Yeah. Director?
Just on.
Okay, just in answer to that question, there's some amount of discussion taking place to exactly what will happen. And bear in mind that an elevated temperature doesn't mean you are COVID positive. Suffice to say, though, we are working on what will take place after that in an instant way that will take place, and that those final details will be announced sometime later this week. So we will be checking. We'll be taking all the temperature of everybody that comes through that gate.
Can I just ask a question that came in on my chat WhatsApp? A person, someone wants to know if there's any sort of special arrangements for persons over a particular age. Is there any special arrangement for those persons over 65 or 70 or?
It's certainly at the commission level to be taken a decision that's under discussion in terms of expanding what we'll do. But suffice to say, though, what will happen certainly when the elderly turn up on the day itself, the supervisor, every location will have an EOJ supervisor. That supervisor will seek to channel that person, usher that person up to the front of the line. Okay. We are appealing to the other electors in the line to be a little bit patient. The intention here is to get those persons in and out of the polling station as quick as possible.
Right.
So as soon as that elderly person turns up, the supervisor will seek to put that person to the front, or take that person to the front of the line.
Okay, so maybe some signage to that effect. I'm just throwing out a suggestion. Would be useful, Commissioner. But I take the point. It's like going to the bank. Senior citizens get particular priority attention. So that's good to know. Okay.
Right. We're looking at there'll be a number of signage there. Certain signage as relates to the protocol itself will be on at each location. And that's why we're looking at what other things that we can do to assist that group of persons.
Okay. Thank you very much. Next question.
Thank you very much. We're going to go to Jamaica Social.
Hi, good evening, folks. I have two questions. One first for the minister. and I suspect the CMO can tackle the other one. Minister, you mentioned many weeks ago, I've been following your COVID conversations, and you did say that your geo fencing technology, there were loopholes and issues in there that you had to iron out, and you were even considering updating the technology and getting even better technology. What's the status of that? Because I'm understanding, just having a general conversation with a number of persons, and they're suggesting that monitoring it hardly ever works, and obviously we know that people are obviously leaving their phones at home. That's a general general information around the country right now. What's the status of that? The other question is to the CMO, and it's regarding what is the protocol, or internally, what is the process of a medical worker who feels that they have been exposed to the virus, and what do they do? Who do they reach out to? Because I got word today of someone who works with the Children's Hospital in the oncology department, and she has come down sick and feels like she may have been exposed to the virus, and it was a struggle for her to get a test done, which she finally did, I believe, on the weekend or Monday, and still waiting for the results of that. She's concerned that another relative of hers has now taken ill and still can't get any word, and she very disheartened that as someone who's in the system, it's taking so long for her to get tested or get her results, seeing that she works with children. That's it.
All right, so the answer to your first question may not fully satisfy you, because I don't have a thorough update on whether or not or how many changes have taken place to the Jam COVID app. Just to say though, first of all, the app is managed through the Office of the Prime Minister, and but we of course collaborate, coordinate, and work very closely together. The app does work. I wouldn't say, as you have, that most of the time it doesn't work. I'm paraphrasing you. I think that was the impression I got. I think though, with the sheer numbers, the more the numbers, the more you have cases of persons who are tempted to breach, and breach more being the geofencing breach. When they go home and they're supposed to observe, they find ways around leaving the phone with someone and that sort of thing. And that has definitely been an issue. There are measures that have been put in place to create, what do you call this now, a device that you put on, a watch? The bracelet. And we've actually brought in bracelets. I don't know what the numbers are, and that is being used in some cases. And if you tamper with that device, then it triggers an alarm. So that's not so easy to breach. And so that is part of the mix. So I guess that could be considered one of the upgrades to the process. The other challenge that I understand was a problem at times is the extent to which at the airports or elsewhere, depending on where you are, the Wi-Fi signal or the telecommunications technology, to be more general, allows the connectivity between the device and the central monitoring. And where you have an issue with that, it does create a problem, whether in uploading the information from at the airports or otherwise. And so those were issues. But the extent to which persons upload the information when they are overseas, as they're all required to do, and the extent to which that information comes to us, and this is where the medical team now interact to vet and to approve, there has really not been much of an issue there. We may have one or two little things. Sometimes it's because persons don't fill the form out properly, so it keeps asking them questions. They don't read the instructions. Persons have called me and WhatsApp me about challenges, and it's easily sorted out because you don't go through the stage by stage process. So I think generally speaking it has worked, but like with all technology, you're going to have periods of downtime, and we try to resolve those as the case may be. the issue. CMO, you want to address the other?
Okay, well, I would believe that different hospitals would have different processes in place in terms of how it is that they deal with the persons who want to get tested within hospital. The most logical thing would be that you would visit the accident and emergency department and get to get tested. We have, however, had discussions with our infection prevention and control teams within the hospital. These are various committees in hospital that deals with infection prevention and control measures. And we have asked those IPC teams to take on the role of the risk assessment of healthcare workers and to keep a track of healthcare workers that are affected, their exposure, and to ensure that there is follow through in terms of monitoring of these persons. I can't give a report right now in terms of the effectiveness of the measures that we have put forward in terms of if they are being carried out in all hospitals. It is very concerning that at a major hospital like the Bustamante Children's Hospital, that something like that would not have been dealt with promptly. But I think that I am supposed to have a discussion with the senior medical officers tomorrow, and so therefore we can look at that to see how it is that we publicize to staff what it is that they are to do in case they become ill. So we will certainly work on strengthening that detail in terms of providing immediate support to our healthcare workers. Another measure, as I said before, that we really have to work on how it is that we support our healthcare workers, especially at this time. So we will look at that closely now that you have brought it up and see how we can address that matter very quickly.
Thank you very much. Stephen?
Thank you much, CMO. One final question from Henry Shirley from Reader Jamaica.
Yeah, good evening, everyone. Yeah, the CMO mentioned, well, displayed a list with the cases from St. Thomas. If my maths are correct, it said 160 cases for St. Thomas. Now, on the 23rd of August, the JIS issued an update which stated that St. Thomas had 162 cases. Since then, on the 24th, we recorded 14 more cases. On the 25th, 5 cases. And on the 26th, 8 cases. That totals 189 cases. So I just want to know what is the total cases for St. Thomas.
Right. So what you have to recognize is that we're talking about active cases. So this problem in St. Thomas started, I believe it was the 29th or 30th of July when we started to pick up cases in St. Thomas. So therefore, many persons would have completed a 14-day period of isolation if they are asymptomatic and would have been released from isolation, so they would no longer be an active case. The very early part of the investigation, we would have seen most of our cases. So you will see that number dropping off at one end, and for the cases that we're picking up, building up at the other end. So you're not going to get an absolute number unless we give you the overall number of confirmed cases for St. Thomas, which we can provide at some other point. But right now we're looking at the active cases.
Thank you very much, Simo. We're going to go to the Minister to give his closing remarks.
Okay, thank you very much. Ladies and gentlemen, we have been at this a little longer than we normally are. It's now 17 minutes past 8. We normally go on for maximum 8, an hour and a half. I want to just use the opportunity, however, because I think it was well worth it in terms of the issues that have been covered. Thanking the usual team, the CMO and the Permanent Secretary, but more so the special invited guests, our Director of Elections, Mr. Brown, who was on earlier, and his useful information and his time spent to respond to questions Thank you very much, sir, and we will continue to work with you. Of course, the university team, led by, in this case, Dr. Bruce, we want to thank him. He spent a lot of time at the wicket and responded to important questions from Dion and, of course, this statement. I suspect that the concerns will need a little more ventilating. I think maybe some more discussions with the doctors, and also, if necessary, with the public, because the university system clearly is very important to the overall medical team and infrastructure. And we don't want any doubts or concerns that is not addressed, or either real or perceived. And I think the public discourse will address both. So I'm sure you're up to it. So we will have some discussions. I'm told that the PS will have a discussion with you after this meeting to begin to address any concerns around personnel. But the ministry is always here to give the support. So I want to thank you for that. In terms of my final comments, again, I want to just reiterate that this is a phase of COVID that requires a different approach. And this is not an excuse for positive cases. And clearly, every death is tragic. We don't want any deaths. And to the extent that we have, how many now? 19? 19. It's 19 too many. So we are doing all we can at this level, and we depend heavily on the rest of the public health team at the level of hospitals, communities, health centers, and otherwise, the lab and so on, to do their part. And they are playing a very important role. But this phase of living with COVID, of trying to restore some sense of normality for persons to go back to work, to continue their normal life, it's so important that we recognize that there are risks associated with that. And all of us have a critical role to play in that regard. And so the approach is to improve or increase the complement of public health workers, which we're doing. I've explained that. To focus a lot on the surveillance, community tracing in the field, because that's where a lot of the action is going to be because of home quarantining and so on. To prepare the hospital infrastructure, to add beds where necessary, to expand, to move around where necessary, to provide protective equipment, personal protective gear for the staff, and to solve the problems as they emerge as it relates to overcrowding. And, we have to expect that some of these things are going to happen. And the intention is to respond to them as they happen. And so we have to prepare our minds for this over time and really celebrate the efforts and encourage the efforts of those who are making the sacrifices and those who have to respond. And the ministry is very aware of that. And indeed, it's a part of the overall plan of what this phase entails. And of course, the third pillar of this new approach or new phase is the role that we all play as individuals, non-medical individuals, citizens, community folk, stakeholder groups. The truth is, a lot of the risk profiling will be impacted by how careful or how careless we are. And so we shouldn't ignore the protocols. We must abide by them, the masks, the stay at home, the sanitizing. Indeed, in my travels to look at areas or to support the team on the ground, depending on where in Jamaica you are, if you are in the hills, in the deep rural parts, you'll get a little remark sometimes from some of the folks that COVID not down here or COVID not up here. And it has become a very popular phrase, and it's an indication of persons thinking that COVID cannot get to them until it reaches. And so the decision to show where it is, even in the most remote parts, because as Jamaicans, we're all connected, and you'll be surprised to know how much we move around. The truth is, no matter where you are, COVID can be present and perhaps is present. So the third pillar of community, individual knowledge and responsibility is so important. So one of the critical parts of this phase and the pillar that is important is the communication, to keep the public informed, keep them involved, be as transparent as possible so persons know exactly what is happening. And the COVID conversations is a part of that, but there are other things that we will do in the future to enhance and to make that a critical part. People understanding, people knowledge, and from that hopefully solicit people response to this challenge. So in closing, 66 new confirmed cases for the last 24 hours, bringing the total to 1,870. The parishes with the most numbers, Kingston and St. Andrew 32, Clarendon 12, St. Catherine 14, and 1, 2, or 3 cases in Manchester, St. James, St. Mary, Westmoreland, and St. Anne. 65 of these cases under investigation, meaning the contact tracing has been triggered. So that's the basic information. The other worth noting is that we are moving now to engage, effective September 1, 121 medical officers who will be deployed across the country. We have 750 community health aides out in the country. We're getting another 250. And we will be moving to look at some numbers as it relates to public health inspectors who are going to play a key role in managing the protocols or doing the inspection, overseeing the protocols. And on a happy note, because there's a lot of success in the challenge of COVID, we have 933 Jamaicans who have survived COVID. Yes, the deaths are in the 933? 50, active cases, yeah, but what about the non-active? That's about 847, 6. All right, fine. So let me adjust my math. I'm reading from the reading the wrong figure. So 847 Jamaicans who have survived COVID. They had the virus. They isolated or were treated, and they are now absolutely normal to be reintegrated. And Stephen, we have to start telling the good news, because COVID may be keeping, but people can overcome as long as they follow the procedures. So we want to celebrate their successes, and we want to encourage those who are under treatment and the rest of us to avoid, and if we have symptoms, to report. Thank you very much. God bless you. And we'll keep in touch as we continue to manage and respond to COVID-19.